I can imagine. I think these are busy times for everyone at the moment.
They certainly are. They certainly are.
Indeed. Appreciate you dialing in and joining us today, Gail. I think it's going to be useful just to give people a bit of a rundown of why the vaccinations are a crucial element of our way out of COVID, essentially.
Yeah.
And if people are already called for a vaccination, they should really go ahead and kind of continue with the mechanism that has been set out. So would it be helpful if you can give a bit of a rundown of why this is really critical stage at the moment and why the vaccinations are crucial and how we should go about them whenever we are called about them?
Okay, well, the thing with the coronavirus, as we've all found, it's obviously a dreadful disease. And as we know, the death toll has been pretty tragic in this country. It's a very difficult virus because not everybody gets symptoms. So if you cast your mind back to the SARS outbreak, we were able to isolate everyone who got SARS because they always had symptoms. So we're able to isolate them, stop it spreading, and that's how we controlled it. But with coronavirus, we can't do that. So we have now starting to get a few tools to help us. The first thing, of course, we do, as we all know only too well, is go into lockdown. So we break the chain of meeting other people. If you don't come into contact with other people, you can't spread any viruses. But that, of course, is something we really want to get out of. So what we need to then try and do is to make everybody immune so that they can't get the coronavirus. And that's where our vaccine program comes in. And the vaccines that we now have authorized are actually proving very effective. It's early days in terms of knowing quite how long they might last for and how well they can break our ability to transmit the disease. But what they are doing is stopping people getting seriously ill with it. So, as you've probably seen from any of the papers or the updates and the news that you watch, our hospitalizations and our death rate has absolutely plummeted, which is really good news. So that's one step. Now we're just at this slightly tricky stage where we've got a large number of people vaccinated, but not everyone. So there's still quite a lot of people out there who can potentially get the infection. And because they might get it without symptoms, they might be passing it on to other people. And the more this virus comes into contact with other people, the easier it is for it to mutate or change into a variant that will actually defeat our vaccines so that the vaccines will stop working. So it's really quite important that we follow first of all, follow all the lockdown rules wherever we are in our process of coming out of lockdown. And secondly, when you're called, get your vaccine, because the more of us who are vaccinated, the harder it will be for this virus to change into something that can beat our current defences.
That sounds good, Gail. And in terms of the lag time or the gap time between the first dose and the second dose of these multiple vaccines, what's the view on that part, in a way that many people have been called, because the program started to roll out in age-wise categories of 90 plus, 80 plus, and all that sort of stuff. So is that a consideration that now the rules have been kind of made a bit lenient today for lockdown? People might have had their first dose. Should they still be considering safe kind of distancing, masks, and everything else? Or is your first jab literally your ticket to freedom, that you can just go ahead and go back to normal if you can?
The first dose seems to be giving people a lot of protection against getting severe COVID. But we cannot, none of us, whether we're vaccinated or not, can act as if there are no rules and social distancing and masks and things in place, because we can't get rid of all of that. The two things that will be able to free us from all of that is a low transmission rate. So we've got to keep the transmission rates low, which at the moment we're doing by keeping our distance from other people and by washing our hands, wearing our masks. and then making sure that everyone that we possibly can gets vaccinated. So it has to be a combination, and you can't rely on just one factor in the same way that we couldn't just rely on social distancing and hand washing and wearing masks to get us out of all the restrictions. We can't just rely on the vaccinations. We've got to really suppress this virus until enough people are vaccinated.
That sounds fair. And Gil, just very quickly, I think on the last part is about the choice of vaccines available, and there's obviously some concerns about some manufacturers versus the others.
Yes.
What's the general view from your perspective, all in terms of the choice available and the rollout of all the vaccines that are kind of in practice at the moment across all of UK?
Well, we've at the moment, of course, we've got 3 vaccines, and 2 of them, as we know, are ones that we're now starting to use more on the under 30-year-olds. This is really being very cautious. I think people should just bear in mind that no medicine, whether it's a vaccine or any medicine that your doctor might prescribe for you, or indeed any medicine that we buy over the counter, is without side effects. And they can be really, potentially fatal side effects. So we will never be able to eliminate all risk from our medicines, unfortunately. To give you an example, of course, we know that if you're regularly taking ibuprofen, we know that slightly increases your risk of heart disease and strokes. And we consider that a very innocuous medicine. So all of the vaccines have potential adverse reactions, and we have had, as you know, some rare clotting problems following the vaccines. Now, the Pfizer vaccine, obviously the vaccines we've used most have been the Pfizer vaccine and the AstraZeneca vaccine. The Pfizer vaccine has reported fewer fatal clots than the AstraZeneca. But there have been, people have been getting clots from that vaccine as well. We need to also take it in the context that in this country we expect to see about 2,000 to 3,000 clots a month that would occur naturally in the population. Our concern has been slightly that we're seeing slightly unusual clots, from particularly from the AstraZeneca vaccine, but the risk is still incredibly low. So that for younger people whose immune system is probably a little bit more vigorous than some of us who are a bit more mature, their immune system seems to get overstimulated from the vaccine. And so they just seem to be a little bit more prone to these clots than older people. But even so, for younger people, it's really, at the moment, it's looking like maybe 1 in 100,000 people under the age of 30 might get one of these clots. So that's actually a very small amount. If you imagine if you were entering a lottery and they said you've got a 1 in 100,000 chance of winning, you'd sort of think, oh, well, there's not much point to that. So we do need to just bear in mind that these risks are actually very low. And as you get older, the risks get even lower. So we see them, much, much lower in older age groups. The risks are so small. I mean, anyone who's had, say, a yellow fever vaccine would know that these days we always tell you about the risk of dying from your vaccine. And in actual fact, that's probably got about the same, if not slightly higher risk of dying from that vaccine, but we'll happily take it to go on holiday. So we need to sort of try and keep a little bit of perspective about the potential side effects. But we just need to think about 2 things. One, that the vaccines themselves are really, nobody who's had any of the vaccines has developed severe COVID. So that's, really, really good news. And we need to just be aware of what side effects we should report to our doctor. So it's really thinking about severe pain. I mean, if you're developing a clot, you won't get just, you know, a sort of nasty headache. It will be severe. You'll know that this is different to a normal headache. You will know that the abdominal pain, if that's what you get, is different to what you would normally expect. And anyone who gets sort of pain like that is really different to what they expect, then you need to sort of immediately call 111 and discuss your symptoms. We know that at least you've got 75% of people who develop a clot, if they report it promptly, will make a full recovery with treatment. So we do need to be aware that there is this slight risk, but your risk, even for younger people, your risk of dying from severe COVID is higher. So our best chance is still to take the vaccine when you're called.
Exactly, yeah. Benefits outweigh the risk in that domain, obviously. Yeah. And I think just very last point, Gail, in a way, if somebody is called up to vaccine, is there any precaution? Do you need to prepare for something? What's the general? I know 32 million odd doses have been handed out, but just if somebody is listening it for the first time, if they are called up by the GP that your vaccination is now due or available, is there any precaution to be aware of? What's the preparatory process around that?
But what we do when you're called for your vaccine, one of the first things we'll do is go through a few questions. There are some people that we wouldn't want to give the vaccine to immediately. So if you've got an allergy, if you've had particularly a severe allergy and anaphylaxis to anything, we want to know what that is, because if that ingredient, it's unlikely, but if that ingredient is in the vaccine, we wouldn't want to give you that particular brand. We'd go for another brand. We want to know now, of course, if you've ever had a clot in the past. If you've had something that caused a clot, then we're going to think a little bit more carefully about which vaccine we want to give you. Then we'll also want to know whether you've had COVID infection, been diagnosed with a COVID infection within the last 4 weeks. So we don't want to give vaccines if you're too close to having actually had a COVID infection. And that's, again, because we're not entirely sure if your immune system will be overstimulated if we vaccine whilst you've also got the illness. But apart from that, really, so long as you're feeling well, I mean, obviously, if you just happen to have a bug at the time and you're feeling a bit unwell, it's better to put it off until you feel better. But there's very few things that we would call precautions or contraindications to a vaccine. But we do obviously want you in good state of health when you come for it. And just, remember, there's no real limitations to what you can do afterwards. It's what you feel like. We know if you've had a COVID infection before, you are more likely, sadly, to feel a bit poorly after your vaccination. And that's normal. Some people have felt really quite poorly afterwards, really headachy and achy and shivery. But you can take paracetamol, and that should help it. So if you're sort of feeling that really headachy and it's getting worse and paracetamol's not really helping it, that's the sort of side effect where you'd want to be calling 111. But otherwise, just take your paracetamol. It will settle. It doesn't really matter whether you get side effects or not. The vaccine works just the same, so it's just as effective if you get side effects or not. Some people just seem to be a little unfortunate and develop these side effects, the temporary transient ones. What you shouldn't do afterwards is take any aspirin or ibuprofen, because they can actually suppress how well your vaccine works. So really, there's not too much to it. We just check that you're all okay, and that there's none of these questions are telling us that we need to give you a specific brand or need to delay giving you your vaccine until a week or two. And then you just have your vaccine, and happily, well, as you know, we've done 32 million people now, and the very vast majority of people may have felt a bit poorly afterwards, but have all gone on to fully recover and be absolutely fine.
Makes perfect sense. Gail, appreciate your time late in the evening. So really appreciate you dialing in and speaking to our audience. And hopefully we'll catch up sometime in the future again.
Yeah, no problem. And just tell everyone who hasn't had it yet, we are trying to do our best to look after everyone, and try not to worry. If you are concerned, speak to your doctor or your vaccine team, because it's better to talk about your worries and concerns than to not have your vaccine, when a discussion might just help you make up your mind.
Makes perfect sense. Appreciate it. Okay. Thanks a lot for your time, Gail.
Okay, thanks. Bye.
Bye. Great. So I guess you heard from Gail, and hopefully we'll continue with our sessions tomorrow again. So see you all tomorrow, inshallah. Assalamu alaikum wa rahmatullah.